From SiriusXM's Doctor Radio, this is Coronavirus. Everything you need to know now.
From the Emergency Medicine Show, Dr. Billy Goldberg and Dr. Howard Greller.
Ken, welcome to the show. How can we help you?
Okay. Real quick, appreciate your show. Listen to you. I drive a lot. We have a couple truck dealerships, so we're trying to keep the trucks moving here.
Thank you.
We have a lot of people coming and going, but we had a situation today. We have one of our employees who on Sunday evening was exposed. We had our first case here in southwest Kansas, a man who's severely ill, and his mother had, where he was staying, he came from out of state to see her. He was severely ill, and they didn't take him in, I think, till Monday. But our employee had contact with the mother, an elderly lady, on Sunday night. Two questions. One, could he have been compromised by this interaction with the mother? And two, if we were able to get him tested, if we are able to, would it show right away would a test, do you have to actively have it, or how does this work?
So these are great questions. This is the kind of things that people are asking. They're also asking, if you get it, can you get it again? So there's a whole bunch of things that Howard and I will jump in and talk. So in general, you hear about this 14-day quarantine period. So usually after an exposure, somewhere in that 0 to 14 days is when you would expect someone to get symptoms. We're really thinking somewhere in the range of 5 to 8 days is the most common area when people get symptoms, but it's after 14 days. You're probably, if you've developed nothing, you're probably safe. Again, this is the normal range. There's no absolutes in that. We are not testing people without symptoms. And the reason why we're not testing people without symptoms is in the absence of symptoms, there's a lot of false negatives for the test. So that you can test somebody, it can come up as negative, but then they will develop symptoms later. So we're not testing asymptomatic people. Can you give it to somebody if you're asymptomatic? That's where we're not 100% sure. We think that could happen in kids, and it potentially in adults, you could be contagious right before you develop symptoms. And that's true with a lot of viruses. Howard, what else do you want to add in? Because you have a lot of thoughts on this.
I mean, the other possible route of exposure is that one of the things that we know is that this virus can persist on surfaces as well. And so it may not necessarily be contact with the person, but it may be contact with the environment. The testing of asymptomatic people is also because right now we don't have the tests to test everybody, and we're trying to reserve it for people who have symptoms or are sick. But in terms of the person that had the potential exposure, they should, if they're well, then they should do the things that we're talking about for everybody right now. Again, it's distancing and isolation and hand washing and hunkering down.
We want everybody to socially distance. We want everyone to be careful with their hand washing. And then if you have a known exposure and you develop symptoms, that's when you seek care. Doesn't mean you need to go into the ER. It's you make contact with your doctor and they begin to give you guidance so that you can know where to go.